loving and caring and kind and compassionate you are, the same as Wheelie Chronic. I don't know if you know that creator,
yeah.
Wheelie Chronic.
Yeah.
She's exactly the same, and I didn't want either of you to fall for her bullcrap and end up helping her out or trying to facilitate help for her, because she's just, none of us need that, especially with the situation, especially that you're in. You don't need that.
What I find, and I don't know about anyone else, right? Anyone else who's chronically ill, we tend to power through. That's our thing. Because we've dealt with it all of our lives, we tend to power through. We are the worst people to ask for help. We don't ask people for help. So if she's so ill, like, I'm not being funny, but we power through it. And I've seen her dad, like, he's sort of like enabling her. Is that the word? Yeah, that's the word, isn't it? Enabling. Yeah. Whereas my mum's just like, well, you've got a child, you've got to do this, you've got to do that, you know. I don't know whether it's because I'm a northerner.
No, it's not. It's every mother.
Exactly, isn't it? It doesn't make sense.
You know my situation, trying to get pain relief on that chemo. And it's because of dickheads like her. Oh, sorry. No, I'm not sorry I called her that, but I'm sorry I said it on live.
Well, it does boil your blood though, doesn't it, Heather? Like, you're thinking, really?
She makes me so angry, it's unreal.
Yeah.
Somebody's asking, why is her father now backing her story up?
Right, her father backs the story about, for those who don't know, she had a sister when she had a sister, and when they were much younger, her sister passed away from a brain tumour. And from what we can tell, that's when Kirsten's illnesses started. Now, I've heard the term, and I didn't know this term myself, I've heard the term glass child being used, and apparently that's a child that just gets ignored and pushed to one side. I don't know, because like both me and my sister were pushed aside in one way or another, so we were both glass children, I suppose. But apparently glass child is when you've got one child who gets all the attention and another child who gets absolutely nothing. So that's correct. From what I can gather from the situation and the way it looks from dating things back to when everything first started, it started off with an ED, and she was just at around the time her sister was due to pass. Oh, there we go. For God's sake, Nico Neve has just said she wasn't sick until high school. I was in a year at school. She lied constantly throughout school. What doesn't surprise me. So what I think it is, I think that her sister had tons of attention. She got very jealous, so she acted up so she could get attention. And then when her sister passed, she filled the gap that her sister had left, and her dad, instead of changing the love that he could give out to a child to one of support and like a normal child would get, he transferred his caring onto her. And if you hear the way he speaks to her, it's very much like she's a young child. He doesn't speak to her like she's an equal or like she's a grown-up. He speaks to her like she's his little baby. And
then on the other hand, he rubs cream into her breasts.
You're joking. I was my dad's little baby boy. Jesus. You're joking now. My mum had to turn around and said to me, Dad, I wouldn't have bloody thought.
I swear to God.
Yeah, she was actually on call with me and two ex-mods, and she said that she had, her shoulder was playing her up and she'd got this thing on her chest, and so she needed cream rubbing into it, so she was going to ask her dad.
Hello, ladies. Because that ain't bloody normal.
No.
I call him Jimmy Savile.
It's not.
I mean, when I had my daughter, I was a proper daddy's girl, don't get me wrong. And when I was having my daughter, I had my mum in the room with me, of course, as you do, because it's your mum in it, you know what I mean? But yeah. And I was crying out for my dad, but my dad died when I was 19 and I was a daddy's girl. So I'm saying, I want my dad. And my mum's going, well, he ain't here now, push. And I'm like, really? You're dead lovely.
Sorry.
No, but it's true though, isn't it? And if I'd have done that with my dad, my mum would have gone, I wouldn't have bloody thought. I mean, I could get whatever I wanted out of my dad. But if my dad treated me like that, I can tell you now exactly what my mum would have said, because my dad was in the army for 22 years. He was soft as anything with me. I could get what I wanted out of him. But my mum ran the house. Not him, my mother. You never challenged me, mother.
Mother still runs the house. What are you talking about? That she did run the house. She runs your house now.
Well, yeah, she does, actually. Her aim's got a lot better because she can't actually chase me anymore because of the cancer. So now her aim's got a lot better.
Nicole, what's this about the bed baths? What? Please tell me you're joking.
What was said? What was said?
Someone said about the bed. She has a bed bath from him.
No. The chat about her bed baths make me giggle. She doesn't mind them.
Sick. Please don't.
Right, to answer questions, right, just to make everyone aware, just so you know, I know you're all probably aware already, we have someone on, and I'm not going to say their name out loud, we've got someone on who is screen recording the live. That's one, to protect us, so that she can't say, oh, it's a hate live, because what we're doing is raising awareness. So she can't do that, and it's also for evidence, so that it can, anything that's said, if there's anything said that where people have got evidence and things like that, they can be contacted afterwards. And it's also so that it can be shared on YouTube, so that people who aren't up at this time or have jobs or whatever and can't watch the live can still actually watch the live and get updated with everything that's going on. Because it's
I can understand her carers doing her like wash, but not when she's asleep. That's a load of bollocks. They're not allowed to do that.
Apparently
that's the other thing, Lou.
When she was asleep.
Lou, you'll be able to answer this because I presume you're not the only one who does your mum's care.
Well, at the moment I am, but I have done it with my grandma before. Yeah, go on.
Right, so she stated on live that her carers will come in and give her personal care while she is asleep.
They're not allowed to.
They're not allowed to do that.
They're not allowed.
Exactly.
It's classed as assault. Anything can happen.
You've got to give verbal consent.
Yes, you have. And also, if they are going to be helping you in the shower or anything, normally you do a plan with the carers that are coming in as a family on what days to help in the shower, what days this, what days, so that your family knows what days going to happen as well.
Yeah. And it's females, you try to have it female.
Because she's sharing, like I said originally, that the whole point, like when I did my first live, the two aims that I want to get from this, like I said in my video earlier, because I did a little video just to remind everyone I was gonna go live tonight. I want to raise awareness and break down the misinformation that she's sharing, because to be fair, saying stuff like that, she could get her carers fired for saying stuff like that.
Yeah.
Yep.
And also to give everyone who's been affected by it the chance to share their story and the chance to like link up with other people, so they've got support there, because the stuff that girl is capable of doing is unreal. Like she's
probably so vindictive that she would accuse a carer of doing something inappropriate anyway. She's the type of person to do that. If she was asleep,
she's saying
she is definitely the type of person that would make an accusation after.
But
if she's implying it was done in hospital, there has to be two nurses there. Because if she says something about one nurse,
exactly,
they need another nurse to sign as well.
Every time, normally, if you can't give verbal consent, that's when they will go to your family for consent.
Yeah, well,
that's the other time.
I was in a coma and I couldn't consent because I was ventilated and paralysed and all that. So they went to my mum for.
I was going to say they would have asked your next of kin for permission. Like, I only know because of my auntie.
I've just called her on the Facebook gastroparesis Facebook group, asking people if they've got NG tubes or NJ tubes she can have.
She's just still asking for them now. Right. Singing journalist, could you
honest truth, Emily, she's on there asking if anybody's got any NG or NJ tubes.
Could you screenshot it for us? Because she has been saying that she doesn't access that Facebook account anymore. So if you could screenshot it for me and send it to me on Facebook, I would absolutely love you forever, because that would be wonderful.
As you know, with everything that's going on at home, my mum and all the stuff that's going on, and we have medical items delivered to the house, right?
Yeah.
Now, the thing is, when they send so many out, and when you start to get low, you have to ring them and request them again.
Exactly.
They never let you get beyond your means too low, and if you get too low, 9 times out of 10, they say ring the district nurses and they'll send something out to cover you for that period.
Yeah.
So I don't understand this whole of running out of things. I'm sorry, but I have never known someone to run out of medical equipment, stuff that's needed, things like that. They don't allow it for a reason.
Bottom line is, she shouldn't have to buy any of her equipment whatsoever.
No.
I do a lot, but that's my own fault for not ordering them.
No, but you can say because when I go to the doctor
If
for a
it's an
blood
emergency,
test,
I could go
they
into
always
the
use a
local
bigger
A&E.
needle, and I like the butterfly ones. Sometimes my dad will order certain needles that I like in my arm because I've got autism, so I don't like the bigger needles that the district nurses use. That's fair enough. But when you've got chronic illness, like apparently she has, you don't need to access or buy your equipment that is necessary to keep you alive. Now, the other day, I was on her live and she blocked me after I asked this question. I said, "Why do you do this?" She said, I like the attention and I'm not sure how to ask for help. That was her very words.
Sounds like medical Barbie.
Can I ask a question though? I've seen a lot of people mentioning epilepsy. She's claiming she's got epilepsy or something.
She claims it's POTS syndrome.
Right.
She has claimed she's got epilepsy. She flicks between the non-epileptic seizures to she has epilepsy to she has photosensitive epilepsy. So she'll flick between the three, but she will always say that her seizures are real. And they're not. They're blatantly not.
Or they're caused by low blood sugars, which I can assure you they're not.
The reason I ask about the epilepsy is my niece is severe epileptic.
Yeah.
She lives in a assisted living bungalow, so she has some independence because I'm 37 and she's turning 35 this month. But she has the mental capacity of a 7-year-old. She's had brain surgery and all sorts for the epilepsy. And to be fair, she wasn't supposed to live past the age of 10. And she is now nearly 35. Now, when she has her seizures and she goes she has pretty mild and tonic-clonic seizures, to be fair, she has both forms. But when she goes into, what's the terminology Joachim uses, ma'am? Clusters. The ambulance is rang, and then she still has to go to hospital to be checked over because they've given her so much medication after she's had all the medication she can possibly have at home. Has she been to hospital after these seizures, or is it always on live?
She always refuses to go, apparently, but she does have the helipad out twice a week.
Yeah, and they couldn't get her out of the window, apparently.
Yeah, no,
They had to leave her at home.
No, they wouldn't, because it's brain. Because it's something to do with your brain, and it can affect your heart and everything. They'd have to take her into hospital to check her if the paramedics come out. They have to.
I know when my sister has a seizure, which is Heather, I have to prime it, and if it goes over a certain amount of time,
they have to go in.
I have to ring an ambulance, and they tell me to make sure one, she's breathing, and they tell me to put my hand against her nose so I can feel her breathing, hold her mouth, and then roll her on her side to make sure she doesn't swallow her tongue. They tell me to hold her tongue down, and they say, where's her medication? And I explain what medication she's got, because I can't remember, I've got brain like a sieve. They tell me which one to take, to give her. If she's already taken it, don't give her anything else, give her this, and wait for an ambulance to come.
Yep.
Somehow you know what to do though now.
Apparently on one of her lives she was explaining that she had a cardiac arrest. They brought her back. They couldn't get her out the front door and they left her at home.
Sorry.
I mean, what a pile of
bollocks.
bullshit.
Right, I'm sorry guys.
Pile of bullshit that is.
I'm sat here, my mum is actually sat on the other sofa and she's looking at me as if saying, what the hell is she on about?
Apparently she had a cardiac arrest and they left her at home.
Mum, I'm not laughing at you guys, I'm laughing at my mum and her facial expressions.
Tasha says she was on Mother Noodle's live earlier saying you are all going to get in trouble if you do not stop.
Bring it
I
on.
could do with a bit of Prison Break. Come on,
Bring it on.
bring it
I don't
on.
care.
I mean, I've
Bring it
got
on.
4 kids. Bring it on. Got 4
Yeah,
What
kids.
she
Come on.
doesn't tell people though, Kirsty, is that everyone on here has offered her help as well.
yeah, we
They've
have.
offered her help. They've held out their hands and said, let's get you some help and let's find out, what is true and what's not, maybe. But let us get you some help and you can get on top of this. But she's taken no notice.
I mean, I personally haven't had any interaction with the lass. I've never spoken to her or anything.
Don't do it. You won't be able to afford the therapy afterwards.
But I've had people messaging me, and I'm like, who is this person? Do you know what I mean? Like,
And blocked me.
and that's why I messaged you, and I was like, Emily, what's going on? What have I missed here? What's going on?
Yeah, she called me a twat and then blocked me.
Yeah,
She's going to let you reply.
Laugh, Lou. Watch her from the For You page when she goes public, because what she does is she'll go private for a while. She'll go private for a while because she doesn't want anyone to. She doesn't want people to join, and then she'll get bored because there's only like 20 people on her live, and so she'll go public, and so then you can watch her from the For You page, and if you do that, she can't see that you're watching, and just. Like we made a joke about take a shot every time she reads the comments during a seizure, and I was like, don't do that, you'll unalive yourself through alcohol poisoning, because it's every time she'll be like that.
I've got 32.
Like that. She reads the comments as she's seizing. It's like, you can't do that.
And takes a drink, don't forget, and chucks herself off the bed with a
And
so-called
wraps her
femoral
in
line
her
that doesn't
hair.
bleed out.
155 times and counting.
Buggies.
Oh, Sean,
Has anyone asked?
Think of the pee bucket, Kirsty.
Has anyone asked if we have Munchausen by proxy?
He has Munchausen.
That's probably, yeah.
Hang on. Can we not talk over each other, please? Can we try and just talk one at a time? Heather knows the answer to that question because Heather was actually in hospital at the same time as she was. So I'll shoot over to Heather. For
Too
that
many
answer.
bloody times. So she has what they call FII or F11, whatever it's called, fictitious disorder by internet. So Munchausen's by internet. She was diagnosed that when I met her. That was 2021, I think it was, or 2020. Borderline personality disorder, and her anorexia diagnosis was removed because of this fictitious disorder.
She can have anorexia, but use those feeds like they're going out of fashion.
Her anorexia diagnosis was removed because basically what she told me in the hospital, in front of nurses and doctors, because she threw a paddy fit because they removed her tube. This was another time, Emily. They basically told her that because she was diagnosed with this fictitious disorder, it cancelled out the anorexia because it was done for attention. Whereas she would go like 3-4 days with deliberately starving herself to get her mum and dad's attention.
Like we're not saying she doesn't need help. Like we've all said. I mean, like we've all been affected personally. If you watch Sally's lives, Sally is very clinical about things because she hasn't been personally affected. So she shares truths about her lives and things like that. She's very factual about everything, and she tries to keep it factual. But all of us have said in every single one of the lives and every single one of the videos we've done, we're not trying to hate her. We're not trying to send anyone to like go after her or anything mean.
We're trying to raise awareness.
Help. She
Trying
needs
to get her
help.
some help. She needs help.
And she needs to get away from her dad because her dad is just enabling her. And if anything, he has, like, to say it bluntly,
He's
he
the one
chosen
blocking
by
the help.
proxy. He is purposefully allowing her to make herself ill. He knowingly leaves her with strong medication that he knows that she ODs on, and he's just sitting by and doing nothing about it. Now, you know what I mean? a lot of us here are mothers, and there is no way on God's green earth we would ever allow our children to do the stuff that she does. And not only that, but to do it on live. So she's got people like myself who modded for her. I would stay up. You know how ill I am myself. But I would stay up all night because there wasn't another mod that could stay up with her all night. And she doesn't sleep at night time. So she'd be awake all night, and I'd be awake on a live with her all night, filtering out horrible comments, keeping an eye on her, keeping notes of when she was having seizures, ringing her dad at 3 o'clock in the morning because she was having another seizure. So he'd leave his house and get dressed, leave his house, go to her house, sort her out. 15 minutes later, she'd be back on live again. We had a rota for who would take care of her on what nights, and we took it in turns to look after her all night.
She forgets the kindness people are giving to
Moochie
her.
Moo has just said, and rightly so, because I've seen it for myself firsthand, be careful when we discuss symptoms, because she is now picking up on those symptoms and using those symptoms to make herself look more believed.
Yeah, you are completely correct there. Hang on, wait a second.
Have you noticed though, Emily, right? Have you
Hang on 2
noticed?
seconds. Male Beans Be Free has just said, it's almost like she got a surrogate mum from you, from being a mod. She did. That's exactly what I was. Now, if you ask any of my friends, like if you ask Wolfie, mumma of 2, that's her name on TikTok, but her real name is Abby. If you ask her, she will tell you every one of our friends calls me Mumma Ems. Every single one of them. All the friends I've made through TikTok all call me Mumma Ems because they know I will ring a hospital for you and pretend to be your mum or your aunt.
You've done that?
Yeah, I've done it for Christy. I will look after you. I will help you out in whatever way I can. I'll send you little gifts in the post to make you smile, and I will be there for you through thick and thin. It doesn't matter what happens, I'll be there for you. Because I grew up without having that. And I know what it's like to not have that support. So I do that for everyone I can because that's the sort of person that I am. And because her mum is so disinterested, it broke
she
my
was
heart
last night,
seeing
hon.
her. It literally broke. Like, I'm a mum. I couldn't imagine ever not caring enough about my daughter that I'd just leave her while she was seizing for hours. And for me, it was like, so I jumped into that space and I was more than happy to fill that gap in her life. And now I realise, like, you know, I fell for it, her kind and sinker. Everything that she put out, I just believed wholeheartedly.
She forgets the kindness you gave her, Emily.
Her mum had enough, and I quite understand it.
We can't hear you.
I said, is she medicated for her epilepsy?
Apparently so, yes. If you go by her list of actual medications that she says she's on, yes.
Because I've got epilepsy, and when I have a seizure, like, sometimes it's that bad I end up in ICU because I am that poorly off it. Whereas if you have a seizure that's lasting over 5 minutes, obviously an ambulance needs to be called. Rescue meds to obviously stop the seizures. But sometimes there's no in between of, oh, I'm fine, and we go back up and go live 15 minutes later. It doesn't act like that. You're exhausted after a seizure. You sleep.
I just want to bring Emily back.
I've noticed in her lives, she forgets.
I just want to bring Emily May up to talk. So if everyone could mute their mics and let Emily May talk because she's a bit nervous about talking.
Hi.
Hi, Emily. Are you okay, darling?
Yeah, I'm okay. How are you?
I'm doing all right. I'm muddling through as per.
I might stutter a lot. I'm not really used to all of this stuff.
Don't worry, it's fine.
But I was in hospital with Kirsten when I was in an acute ward. I believe it was like 2020. Stayed in contact with her until sort of end of 2021. She did not have any of these conditions that she has been claiming, or at least not the obvious ones. The only thing she had was a catheter. Occasionally she would have NG tubes put in. However, I did provide quite a lot of screenshots to Alex, who used them in videos.
Emily, I think we were in hospital together.
Oh, really?
Yeah, the same acute ward.
Possibly, yeah. messaged me afterwards.
All right, hon.
But I literally, she sent me a message basically saying that she can't come back to the ward because they can't cope with her risk in terms of eating. And she told me that she had placed NG tubes at home, but she told me not to tell staff for when she returns because she will need to take them out before she comes onto the ward. And she also never had any episodes of seizures or anything like that. It wasn't until afterwards when we stayed in contact when she said her seizures were caused through basically a form of SH and that induced her seizures.
Okay.
But she did very much eat in hospital. We would often order takeaways together. So, yeah, and to be honest, I'm sad it's come to this, but for the past year and a half, like, I've been watching her lives and I've instantly known something was up, but obviously there's
Emily,
not a
were
great
you there
platform.
when they pulled her tube out? And
No.
she kicked off? Oh, okay.
No. I can't even remember what I was saying now, sorry. Oh my God, brain fog.
Sorry.
No, you're fine. I literally have forgot my whole track, but...
You were saying about takeaways and things.
Oh, yeah. So we would often order takeaways together, and yeah, she'd eat them. But... Oh, I know what I was saying. Like, I'm sad it's come to this point where she is having to be exposed because for the past year and a half, I've been watching her lives and I'm like, this girl, like, is just, you know, making this stuff up and she needs help. But because obviously I haven't got a big platform and I didn't want to take it up on my own and no one sort of see the truth side of it, I am glad now that people are now starting to see that because she does need help. For her own mental health because it is just getting way out of hand. And to be honest as well, like, I think this exposure is not necessarily feeding into it, but I think she is getting something from it, if that makes sense. But I'm just so glad you are doing what you're doing and keep talking about it because it needs stopping for her sake and everyone else's who watch her live because it is, yeah.
Thank you for coming on and sharing, Emily. I'm pretty sure I have actually got copies of the messages between you and her about meeting down at the cafe and you ordering some food for her or her ordering food for you. Are you that person?
So yeah, quite a lot of the screenshots that Alex has used in videos. We never went to a cafe together. It was often ordering takeaways into the ward because obviously we were both in hospital at the same time. Yep. But yeah, that very much did happen and it was often on her request as well. So yeah, but keep doing what you're doing because hopefully this awareness will get her the right help and also safeguard everyone else involved.
Yeah. Thanks very much for coming up and sharing. Emily, if you've got anything...
Emily, somebody's asking you, was she paralysed in the hospital? When I was there, she wasn't.
No, she definitely was not paralysed.
Told you.
She would often run off from the ward. So, no, she was not paralysed at all. Like I said, the only obvious physical condition she had was having a catheter. Everything else, no.
Heather, when was she in a ward? Like
not an acute award.
I met her in an acute award. It was 2020, possibly the end of 2019 as well. I'd have to go back on messages. We stayed in contact for a little bit when I moved to a different hospital, but she then changed Facebook accounts and sort of blocked me off everything. And I think this is when also these symptoms started to get quite excessive. And obviously because she knew me quite well, she possibly didn't want me to notice this. But yeah.
Emily, can I ask you a question? You don't have to respond to this if you don't want to.
Of course.
Do you have any of the health conditions that she currently claims that she has?
So I personally don't have any physical health conditions. I only struggle with my mental health. So I was very much in the dark. Like, she would often send me pictures or talking very medically. And to be honest, I wouldn't be able to pull things apart myself because I don't struggle with that myself. But there is also one thing I just wanted to add as well. She sent me a screenshot, which I've still got, of this email that apparently her dietitian had sent her. But the first picture she sent actually had her email address that she had sent to herself. She then deleted that and resent the email, and how it is worded, it is definitely not what a dietitian would write. And apparently it was a dietitian that had only met her once as well. But she clicked onto that almost instantly when she realised that obviously it was her email that sent it. Yeah. And I was also the one which the hospitals which were photoshopped, which I knew at the time were photoshopped. But when I sent them to Alex, and obviously TikTok investigators has helped find the original source. But yeah, she was doing that, and those pictures.
Yeah, because the rooms are definitely not like that.
Yeah, like the originals have now been found. And you know, when she first sent it to me, I was like, nah, this is not right. But I just sort of left it. And when all this came to light, I sort of shared all of this with Alex, sent off all the screenshots, because, yeah, it's just escalated over time. And honestly, like, because of how quickly it's escalated, I'm genuinely concerned for her own safety and also the miscommunication that she's saying to other people. It's not okay, and she does need help, and I really hope this is the start of that help she needs.
Would you be willing to send that information on to me, so I could message it on to Sally, because she's the one that's working with the oh my God, what's the big group of lots of different
safeguarding?
Yeah, of course. Yeah, of course, that's not a problem.
Because I can forward it all on to her. Basically, what I'm trying to do is give people the chance to have a voice and to be able to speak about their experiences. And then, there you go, Sally's just said, Sally's actually in here right now. If you want to directly message them straight to Sally, you can, or you can message them to me and I will forward them to Sally. Because
Perfect.
Sally is the one that's collating all the actual evidence. So I'm talking to everyone and filtering through who's happy to do a statement, who's got evidence to provide, etc. And then we're putting it all together. We're all working together. There's me, Sally, Heather, Kiki, and a couple of others whose names I won't say because they don't go by their real names on TikTok.
Do you want any screen recordings that I've got from before she blocked me?
That would be wonderful. Anything like that. Basically, we're compiling everything together so that we can get her the help she needs.
Because I followed her until recently, and then she blocked me yesterday.
She's like under somebody with her advice.
Can I just say something really quickly before I drop down, please?
Yes, sir.
I'm more than happy to send all that across to you or Sally. I did message you before you started your live, but I'll send it all across to you. But yeah, keep doing what you're doing, and fingers crossed it all works out for the best.
Thank you very much, darling.
You too, Emily. Keep going, girl.
Thank
Can
you.
I say something when there's time?
Thank you for coming on and talking.
Oh, thank you. I don't even normally speak to people on the phone one-on-one, so this is fucking scary. But yeah, could you please drop me, because I haven't got a clue what I'm doing?
Yeah,
is that okay?
Yeah, that's fine.
Can I share something when there's a space?
Yeah, of course you can, Sal.
So just out of interest, I'm actually a senior nurse that I've retired due to my ill health, but I was following her and because I fully believed everything until a couple of days ago, and she'd always been as nice as pie. But the more questions I started asking, because I'd seen some photos of this porta cast she claimed she had, and she'd got like a subcutaneous line stuck into her chest, which is completely not possible. And then this business of pushing a orange liquid down it coming straight out again and all this kind of thing. And so I asked her a couple of questions and she was really, really rude back. And then I made a comment about myself being on palliative care as well. So I was trying to empathise with her. And she was like, oh, well, I don't care if you're on palliative care. Like, I'm not. And she's also shared that she was, hasn't she? Said that she's in end of life care and everything. But it was the more questions I asked that were probing, like, why have you got a femoral line at home and stuff. She obviously knew I knew what I was talking about. And so she suddenly completely blocked me off it all. So I've got no power anymore to sort of listen other than what people share. But it scares me how much damage she can potentially be doing to herself. Because the more you see, the more obvious it is that it's all not genuine. The NG tube can't be in the right place. I think she basically cannulates herself. I've seen her with a cannula in her little finger before, which is crazy. You wouldn't be sent home with that to give yourself IV fluids. It just would blow. It's all just, it's scary that somebody can be accessing that amount of equipment to do this.
Yeah,
a subcut line in her chest. It doesn't look like a proper Broviac Hickman line.
It wasn't. She didn't have.
Subcut lines are not even meant to go in the chest.
No, I was going to say I've got a portacath, so it's like a button under my skin. But when they access it, it's quite a big cannula sort of. It's a big square thing that they push into it. You cannot put any other needle, and certainly not a subcutaneous needle, into a port. So there clearly wasn't a port there, but she was pretending she had a portacath, and that was it accessed, and that was a lie, because that's just not possible.
Honestly, the stuff she puts out about the central lines, it's quite funny. So one of my friends asked her about does she heplock her femoral line?
No.
And she went out on this massive spiel about how it's not used in the NHS and it's not used in England. And I'm like, obviously, but it was that, like in some way, like some of the stuff she puts out there, as much as it is potentially not true for her, is still factually correct. But then there's the odd things that are like everything to do with the femoral line is just absolutely
like the
hilarious.
heparin. Where's the heparin?
She doesn't put a heparin lock on it. She doesn't ever use sterile gloves. She never does an aseptic technique or a sterile technique.
Well, yesterday she actually said she doesn't need to for a femoral line, which is utter rubbish.
Yes, you do. For every line.
Exactly. You have to, they have to be so careful with mine. I've had sepsis.
Even with a midline. Like,
exactly.
It's a giant cannula. They still have to use sterile technique.
Exactly.
Yeah, I'm sorry. Can I just say, I am so pleased that I have not actually had any interaction with this person in question. I mean, my mum is literally end of life, terminal cancer, and you've got people like that.
Yeah.
Yeah, she said, the best thing was, Lou, can everyone else mute a second, please? There's background noise that I can hear. She actually said, and Heather and the other girls can back me up on this because it was, thank God, someone screen recorded it and shared it. She said that you could reuse needles so long as it was on the same person.
Yeah.
Right, so my sister is a matron of palliative care down south, and obviously she's down south. And I know for a fact that it's nationwide, worldwide known that is not possible. Even you don't have to work in the NHS to have common bloody sense.
Yeah,
exactly.
Once it's pierced the skin, you have to throw it away.
Were, you can use it. It's a one patient use, not a one-time use.
I heard her saying
I'm telling you now, if a nurse come at me with a needle and tried to prick me more than once with that needle, she'd have the needle up her backside.
What she doesn't understand, though, the needles, when they say they're single use for a reason. Once you insert that into the skin, the bevel at the bottom of the needle bends and curls up. You can no longer use that. You take it out and you throw it away. Never mind the bloody, the infection risk.
Yeah,
you can't even use lancets more than once. You're not allowed to use a lancet more than once because the needle becomes blunt.
However, I would like to point out with the lancet, we all know that 90% of people who stab their finger with lancets for their blood sugars.
Yep. I use mine more than once. I only change it when it hurts.
Exactly. When But yeah, no, like this
But
morning.
that's my point, though. You're told don't use your lancet more than once.
Yeah, you are told
because of the risks. Yeah, but I don't listen to that.
With a lancet are a lot less than a risk, say, with a...
Oh, yes. It's not directly in your veins,
but
let alone your bloodstream or your heart.
The moment that needle leaves your skin again, like, if they, like, pull it slightly out but don't completely take it out, that's fine. And, like, to jiggle it about, that's fine, that's allowed. And, like, jiggle, you know, as they do. Because some people, they push it in and they actually go a little too far and it's got downhill. And they try to pull it back to try and make sure that they get it in right. That's fine. But the moment it leaves your skin, it does not go back in that skin.
No. It's like her saying you only need a clean technique for the femoral line. She was saying, oh, it's not aseptic, I just have to be clean. And I'm thinking, no, that's not true. It's central line. Any central line is aseptic. Yeah.
Because of where it is.
Completely sterile.
I've never ever in all my years of oncology nursing known a patient go home with a femoral line, and I've been a nurse for 32 years in an oncology ward.
So I know of a few people that have had it. However, these were people who were having hemodialysis.
Yeah.
And it was something, basically they had, one of their line had broke or they couldn't use their AV fistula or whatever.
Last
and it was
resort.
a temporary solution. But it is, in that situation, it gets looked at 3 times a week, 4 times a week.
It's a last resort option, isn't it? Like, there's no reason why she shouldn't have a port or a Hickman line or something else if she genuinely had all these illnesses.
Yeah, like if it's something
access, so I don't have a choice.
Like if she's using it daily.
Can we not talk over each other, please?
Like if she's using some form of line daily, she needs something that's like a Hickman because obviously you can use them daily, but it's a lot, and you can have naked showers, as I call them, where you can have washed where you're not covered in lines. But
she's saying her chest is so scarred they can't get a Hickman line in.
Where's the scarring?
I don't know exactly what I was about to say.
There's not one scar on her.
You guys have all had interactions with her and I haven't, right? So can I ask, because I've just noticed a comment there in the section about her being a registered nurse?
No, she was a student nurse. And
she wasn't even a student. She wasn't even a student.
She started an access to nursing course. She never even completed it.
Right.
Can you imagine if she ever got a nursing degree?
She claims that she got her nursing degree, but the day that she was supposed to register for being a nurse, she was poorly, so she couldn't do it.
Rubbish.
That was her excuse.
Right, so my niece had a really bad seizure on the day that my sister graduated with her degree and everything. She smashed all of her face in. She had literally black eyes and all sorts. My sister contacted them, explained the circumstances and that she was sat in the hospital and everything. And they said, no worries, we'll put it on hold for you. It's a medical emergency. You know, we'll do it tomorrow. Not an issue.
No.
Well,
that's why you know she's lying.
There's ways and means.
In this day and age, you don't. You complete your degree. Obviously I don't know how the NMC works. That's not my remit, but how the HCPC works is you get all your stuff. You get your certificate of completion, like you show that you have passed it. You don't get the like your full degree certificate. That comes later. But you literally hand it, and then they just the registering bodies email or have a list. I don't know how they just contact whoever.
The NMC work by when you've done your allotted hours and time and you've qualified. You don't need to attend anything. It's all done on an administrative level, and the NMC will send you out a PIN number, which is your registration PIN.
Yeah, no. Yeah. So the it's just the HCP. It's because obviously they want money out of you at some point, so you do it on the website. But it's all automatic. You just provide them your details, and they just within about 48 hours for most people they get their registration.
It's the same with nursing.
So Jenny, someone in the comments has said, Oh, yeah, she said she turned down a job offer as a neonatal nurse.
Thank God for that.
So it's like the lies are getting bigger now. One that a lot of you don't.
She could be another Lucy Letby.
One that
I
a lot
would
of you
rather
don't
have a
know.
porter look after my child than her. I can tell you that now.